This is the two-way ANOVA video and visualization. To remind you about terminology, when you hear two-way ANOVA, you should think two categorical predictors and one continuous outcome. In this class, we'll usually be interested in the situation where each of the predictors has a small number of categories. In other words, we won't be talking about small area variation models where one of the predictors is hospital and lots of hospitals are included. Nor will we be talking about multi-site trials where one of the predictors is study site and lots of sites are used. There's nothing fundamentally different about these applications, although some of the elements of the analysis are implemented somewhat differently. For example, the visualization techniques described in this video don't make as much sense if they have to be repeated for a large number of sites, each of which has small numbers of patients. As more terminology, cross-classifications of the predictors are called cells. For a two-way ANOVA where each predictor has two levels, 4 cells are formed, as illustrated on the slide. The visualization exercise takes place within cells, no differently than what you've already studied in the one-way ANOVA module. For example, you can use histograms, box plots, normal probability plots, and so forth. Responses to data problems are essentially identical as well. For example, transforming the data, eliminating or downweighting outliers, and so forth. I won't belabor the point here. Data inputs are also presented by cell, as in the one-way ANOVA. For example, in previous slides with 4 cells, the inputs to present in your report are the group means and their standard deviations, and also things like box plots if more detail is desired.